Okay. Welcome to my podcast. This is called, the Instagram handle is @funnypodcast or @funpodcast. Sorry. The podcast name is It's Going to Be Okay. This is my first recording, my first session since I started doing things online. So I have a few intros. The first person that I am interviewing, which I am very happy to admit that she's been a very good friend of mine. Her name is Chika Okoro.
That's me.
Yeah.
Hey guys.
She has been an inspiration to me since I started doing stand up. Sorry, I need to introduce myself. Yeah, I just came in here and I'm like, oh, my mind buzzes. Okay, so my podcast is basically about introducing people, artists, comedians, creatives alike, who struggle with mental health issues or have gone through, kind of the trial and tribulations of learning how to deal with it. And I feel like a lot of people have come out, when they do come out, or even if they're struggling through it, they notice that having a good sense of humor helps them get through it. At least that's how I got through mine or how I'm getting through it. So, I am your host. My name is Carissa Gomez, and welcome, Chika. I'm glad you are, here. You're my first. You're here to break the seal. You're here to break the seal to the podcast. I'm very happy. We are here in Hollywood at Deaf Noodles Comedy and Media Studio Productions. So I'm grateful for this as well. It will be my birthday soon, so this is kind of like just a whole amalgamation of things. But I have Chika here today because she is not only an amazing comedian, but she is also a healthcare professional. And I know we've had a lot of private conversations simply because we kind of share the same background and in terms of education. I am a medical school dropout, and she is not. So she went all the way through. She made it. She made it. Yeah, no, I didn't because of my mental health disorder. I was diagnosed 20 years. I'm just going to give you a background. I was diagnosed 20 years ago with schizophrenia. And that has been challenging in and of itself. And obviously when people come up, they look at me and they're like, oh, you're very well put together. And I'm like, I'm barely hanging on, But I've had a lot of conversations with Chika simply because we kind of share a lot of the things, specifically in knowing how to navigate some of the medical field and a lot of the challenges that come with it. And one of the things I think that stands out is just the fact that how being a healthcare professional in and of itself is contradictory to your mental health. Yeah. It's counterproductive, I think,
Sometimes. Yeah.
So give us, some of the things that you've encountered just being a nurse and, learning how to manage your work, life balance, which I think there is non-existent.
Exactly. So for me, I'm a stand-up comedian here in Inland Empire, Los Angeles area, but my background is an ICU nurse. Recently, I just graduated from a psychiatric nurse practitioner program, so I will be treating mental health disorders and also be licensed to prescribe. That's my background just a little bit. But largely in the ICU, we do have patients that come in, more so like the acute phases, like untreated depression or homelessness or other things that kind of like stack up on top of each other. Like they have PTSD, it goes untreated, then it gets much, they end up in the ICU. It gets much worse over time.
You said acute phases or phases?
Phases,
okay.
Meaning that it's very emergent, it's very critical. Like the goal is to try to prevent it. Like when everyone says like, hey, if you're struggling, go in and get some help, talk to a therapist. Those are like more preventative stuff. But in the acute phase, it means like they need to be like in the lockdown unit right now, maybe restraints, maybe some type of medication intervention. Oh. That's more of the acute phase. Like you have to treat this right now because it's more so emergent.
Okay. Well, yeah. I feel like as a patient, I was in acute phase, but I was also in an ugly one too. So that's just my little tidbit about that. But I mean, have you ever gone from being a patient from being a nurse to a patient? Yeah,
I have myself, yeah,
Okay.
but not for in terms of like mental health, just like physically, like being in the hospital for like a knee surgery or stuff like that. But I know you were talking about how it's kind of counterproductive to your mental health.
Yes, yeah.
So I think even for nurses, they talk a lot about soft skills, like being compassionate, being kind, how to talk to patients. Like those are the soft skills. The hard skills are like doing IVs and like the very specific skill set. But I think a lot of nurses, like, they expect us to be like overly compassionate at times.
Mm-hmm.
And I think we were talking about previously, like in terms of how I've always had to de-escalate a situation.
Right.
Even though sometimes it's to my own detriment. And
Yeah.
now it's like I'm off the clock. I'm in a situation where I have to de-escalate. But actually, you know what? You're being disrespected. You need to escalate. Do something else maybe instead.
Right.
So I think that's one of the things that I'm learning is that, okay, aside from being a nurse, I'm also a human being. So how do I navigate both sides? Like, when do you turn it off, right?
Yeah, exactly. How do you turn off the people pleasing? How do you turn that? Like, I feel like that, when you're in an industry where you're meant to kind of, you're still a human, but you're still trying to take care of other humans, and their bottom line is not necessarily yours. You know what I mean? Like, yes, you're there to be paid, but you're not there to make a profit. Yeah. You know what I mean? And I think that kind of capitalism basically makes people think that they have control over someone else. That concept of the customer is always right. I have always had problems with that, especially, seeing my mom and how she would kind of like berate people. And I was like, that's not appropriate. Even if you think you are correct, I don't think that you should treat people like that. And I think the same goes with, because your nurse essentially, I always think of it this way. They have control over the IV drip, you can just fuck someone up and just be like, hey, you know what? They fucking died. I don't have any control over that. Maybe whatever it was that I gave them, they couldn't handle it. You know what I mean? Yeah. And, you can just move on to another hospital. I don't know. I always thought that was, strange, but I wouldn't want to piss anybody off, especially my caretaker. I've seen, some horror stories, and I wouldn't want to be on either side. So I didn't, I identify with, what you're saying, and I've seen other patients treat their caretakers like shit, and I'm like, dang, bro, you are getting yourself into some trouble.
And I see that a lot too. I think sometimes like people perceive like nurses, I think because we work the most with patients, like they see me the most. Doctors come in and out, pharmacist is barely there. They might come at the end. But in terms of like, for my role, I see the patient the most, like the full 12 hours.
Yeah, yeah.
And I think sometimes patients don't understand it's like, it's in my best interest to help you, because I'm going to have a good day. If you're having a bad day, I'm going to have a hard time.
Yeah, exactly.
So sometimes I think like I'm trying to stop them from getting a medication, or I can't do this, or she's not giving me that. It's like, I don't have control over that. If I had the medication to give it to you, I would. But sometimes like pharmacy has to give it to me. The doctor has to order it. So you do see a lot of patients like tend to be agitated about certain things that's not really in my control.
Right.
Especially during the pandemic, I saw that a lot. It's like, and you understand that this is a situation where it has been like unprecedented pretty much. Mm-hmm. People are just kind of trying to hold on as best as they can. So you see a lot of anxiety. We saw a lot of depression. Family members were passing away and no one could come in and see them. So it's like you have a lot of those interactions, and it's like, wow, I understand patients are having a hard time. I'm having a hard time too.
Yeah.
It was a struggle for me. And I feel like for me, like when I wasn't at work, I was just like sleeping. Yeah. Like watching TV, I didn't I felt like I didn't exist.
You just disconnected from reality.
Yeah.
Because that was your only way of decompressing, was like, if I can't shut down at work, because you're always on, then I'm going to shut down when I'm not at work,
Yeah, 100%.
Yeah. So, speaking of shutting down, I feel like a lot of people, speaking of shutting down after the pandemic, because you guys basically went on lockdown in the place where no one was allowed to go, and I feel like after that, like going through that, this is kind of the reason why I dropped out of medical school, was basically I felt like if I couldn't, the idea, like if you can't help yourself, how are you going to help others kind of deal? That is true. To a certain extent, I think now I'm in a better place mentally, where I've made it out enough to say, okay, well, I have this knowledge, and maybe if I pass it down in a way to other people, it might help them navigate some of the things that I went through. And this is the reason why I have this, this podcast, is because I think a lot of the stuff that we talk about, nobody does it in a funny way. You know what I mean? Especially because it's kind of like a lot of people get sad and, they get triggered. And you're allowed to do that. You should be, because I don't think this is being spoken about enough, and I know everyone's like, oh, we need to have this discussion. We need to have this. But when is the right time to do it, And there's just always so many factors that go into avoiding, some of the important parts of taking care of your health. And I think a lot of the reasons why, now I'm going to touch on this basis where a lot of people, particularly minority groups, will avoid going to the hospital because there's this huge stigma, not only because, it costs a lot of money, obviously. It's ridiculous, the amount of money that it costs just to look for a therapist, or even just trying to find a therapist. You have to get, I feel like you have to go through a psychiatric evaluation to find a therapist, Yeah. So it's like, why jump through all these hoops? Like, by the time I even find my therapist, it might be too late. I might have fucked up the 405 trying to, take my life into my own hands, kind of deal.
And when you hinted on in terms of like the racial disparities piece, like even for me being a nurse, and I even talked to you like, oh, hey, I think I should also talk to someone at some point. And to me, I remember just having a conversation with another male comic who was going to school. He was doing some type of like, maybe like a marriage family therapist or like just a therapist, counseling or of some sort. Mm-hmm. He got into a program. And after having a conversation with him, I told him, I said, you know what? This is the reason why I'm never going to go to a white male therapist. Like, I appreciate that you're trying to help,
Yeah.
I think because it's like, for sometimes people tend to, not sometimes, but oftentimes people tend to kind of dismiss like the racial,
like
aspect.
cultural things that go into
cultural competency is always like a big deal. We always have all this education, and this is an example I'm going to give you for why. So I had a female friend, right, who had an anxiety disorder, but she was going into residency, for med school, and it's like 4 years of medical school. Then you have, I'm just explaining to people who they don't understand, 4 years of medical school, then you pick a residency, and they're there for like 3 to 4 or 5 years, right? And then she was saying how she was talking to her therapist, and that she has like locks, so like dreadlocks pretty much. And she was saying to her therapist, like, I'm not sure if I feel comfortable wearing my locks in the interviews because I don't want to be judged.
Yeah.
And then this was a white female therapist, and she said, oh, your locks don't look that dirty.
Wow.
So it's like interactions like that, to where it's like you already have your own, you're projecting what you think when that's not what I asked. Yeah. So now it's like, I don't feel safe in this space, right?
Yeah.
Because you're already telling me that, okay, my locks do look dirty. So now I have this like reoccurring thing of like, okay, people are going to judge me harshly, even in a therapeutic setting, or even like in an interview. Yeah. And you feel like you have to kind of adjust.
Yeah, basically by getting that bias. It's like a bias confirmation, what
exactly.
you just said, Yeah. Yeah. No, I mean, I get that. I just, oh God, there's just so many things that are kind of crazy when it comes to, I mean, you as a woman of color, you work on both ends. Mm-hmm. You work as the healthcare provider, and then as someone who is adamantly, seeking or speaking to a therapist, mm-hmm. right? So, I mean, give me, kind of some of the things that you've gone through that you wish to impart on people. It doesn't necessarily have to be like a story if you don't want to share, but like, kind of something that like, what was the reason why you started seeking therapy other than the fact that your job would, put you into therapy?
I would say for me, like, I tend to have an avoidance. I think with the avoidance, it comes like when people talk about like people pleasers. I heard this statement like people pleasers tend to be manipulative, and I was like, what do you mean manipulative? I'm like, how? And it's because it's like you don't necessarily, if I don't please this person, then what's the outcome for me? So it's like now I'm trying to take control of the situation. I'm trying to change it around so that I'm avoiding some negative situation. Because if I don't please you, then I'm assuming there's going to be some type of negative thing that's going to happen to me.
I think the person that gave you that projection was probably a narcissist. I feel like they were.
And I think that's the thing too. I think it's trying to find both. Whereas to me, I feel like I haven't found a balance.
Right.
Like, am I doing this because I want to do it, or am I doing this because I feel like I feel like I have to do it? I feel like this is an identity piece. The thing I know about myself is that I'm really good at helping people. Mm-hmm. I think that's something that I'm really proud of. And people like reinforce that too. Like, oh my gosh, Chika, you're so nice. you do such a great job. So then it makes me want to keep doing it. But is it actually beneficial to me?
Right.
Or is it actually a detriment?
Yeah.
I think being able to find the balance between that.
I get what you're saying. I've had kind of, the same problem too, where you're trying to differentiate because you're naturally a compassionate person. I get it. This is kind of the reason why, I wanted to get in the healthcare field, or why people have suggested that I should go back and do it. And it's because we see people who have struggled. We've been in that struggle as well. And, our natural reaction is not necessarily to save them, but maybe to point them into the right direction. But in a way where they don't feel like they're losing their identity, or they don't feel like they're, kind of not doing it on their own volition, And I think that's how you should help. But getting back to the people pleaser thing, I think the reason why sometimes we have to turn it off is because we often get manipulated by people who are just there to take advantage.
Exactly.
Basically, people that are like, oh yeah, I'm just gonna keep pushing it with this person, and she's never gonna say no because I'm always gonna play the victim, and I'm always just gonna be the one in need.
Yeah.
And that's typically, kind of like people with some sort of narcissistic personality disorder. I am not diagnosing them, but I am saying that I've read about like some of the narcissistic personality disorders, and it's usually most people, they don't get diagnosed because they don't think anything's wrong with them. Yeah. And that's the tough part about it, is because, they think they're perfect kind of deal, and I've lived with someone like that. So I'm very familiar with it. And, it's funny when you change the dynamic of where you're coming from. If you start thinking about why you're a certain way, it's because of your upbringing, essentially. So I'm pretty sure like maybe you have someone who is an authoritative figure in your family that has kind of formed why you've even become a people pleaser.
Oh yeah, I think definitely like a Nigerian parent type of upbringing,
Yes.
It's always just like, I think always having to succeed,
right?
And it's more of like, I became more of like a task oriented person. Mm-hmm. And then you see that you get some positive feedback when you do that. So you judge yourself based on those things. But then also it's like, where's the emotional piece? I think someone recently told me, like when we were talking about a situation that happened, where I'm like, this is a chance I should have spoken up for myself and I didn't.
Right.
You know what I mean? And then after the fact, I had to like reflect on that situation, right? But it was kind of like, I don't want to get too much into it.
No, go ahead.
But I kind of noticed the patterns in myself. Like sometimes people always think it's like you're going to therapy because you have a diagnosis, right? I'm going to show up and give you a diagnosis. But it could just be that you go through a breakup.
Yeah.
And there's a loss of some sort.
Yeah.
And you're having a hard time coping.
Yeah.
I'm noticing patterns in my behavior where I don't speak up for myself. So why is that?
Yeah.
It's not because I don't know. It's maybe I just don't have the courage, or I don't feel like it's a safe thing to do. And in situations where I felt like, in the past, traumas that I had that kind of came up, and I didn't have any triggers up until maybe like the last 4 weeks ago. Then I had a trigger. And I always thought to myself like, oh, when this thing happens, I'm going to react in this way. Yeah. Until it actually happened. And I didn't react how I thought I was going to. Everyone's, oh, we're going to fight back. We're going to do this. We're going to do that. And I froze. And I was like, maybe it's because I didn't do that work before. Because they said, I hear like trauma doesn't heal like by you trying to hide it, or you're trying to act like it doesn't exist. Like I said, I always had this avoidance to where now I'm faced with that and I have to deal with it.
Yeah.
So maybe instead of avoiding it for 3 years, because you're like, oh, it's been a long time. I got past it, everything's good, until it comes up and you're like, oh, wow. And it sent me back to where I was, I felt like 7 years ago. Mm-hmm. And that's kind of thing that prompted me to be like, okay, I have all these feelings coming back of like, maybe you're feeling worthless again, or people only want you for this one thing. You don't feel like you can be safe and be vulnerable at the same time. So I have to choose which one. So then I tend to keep things in. So it's kind of like this reinforcing wheel, and you notice these habits. So I need to break that pattern. I think that's kind of where I'm going with it. I think, but people sometimes they feel like therapy is for people to be diagnosed, when it's like it could be anything.
Yeah, no, exactly. And I'm glad you brought that up, because I think that's another reason why people avoid even seeking therapy, or because they always think like, oh, people are going to see me as crazy, and like, so what? That's not the worst thing that can happen, People are going to see you as crazy even if you don't get therapy, I've been in situations where it's just a regular, normal ass person, apparently. That's what they think. And they lose their shit, and then all of a sudden they're crazy, and then now it's like, but he wasn't diagnosed with anything. He was just going through it. It was situational. It was circumstantial, and that is another reason why I think even having the conversation about seeking therapy, it doesn't necessarily mean you're going to get labeled as something. Unlike me, I'll embrace the label. I know, I feel, I've had people that will tell me, you shouldn't be so open with your diagnosis, because then people are going to take advantage of you. And I also feel that that's a projection too. I'm like, then that means that I shouldn't be around you, when that's how you're thinking. That's how you're seeing it. Yeah. But for the most part, me being open about it has had people kind of understand some of my, kind of awkward behavior, or, sometimes I'll get into, little pitfalls in my head when I'm out in public. And, then I'll know how to seek people who can help me out, and people will be able to see the signs kind of, physically, like when I shut down. But yeah, that's another reason, getting back to why people don't want to see therapy or seek therapy is, they're afraid like, oh, well, people are going to see me a certain way. Let them see you as crazy, let them.
And I think that's the thing too. It's like, I think someone's like, oh, I have friends I can talk to. I do yoga, and that stuff is great. There's all these things that we can do for mental health. But at the same time, I think having a space designated just for your healing, like I'm going to spend an hour just to heal, just to learn, just to grow. I think that's also really important. Because our friends are also not therapists,
exactly.
And our partner may be great or maybe not so great.
Yeah.
And they're maybe they're not a safe person, right? We've been in a situation where it's like,
you have, at least you haven't found out, You're like, I'm still trying to, You're still trying to figure things out with the right person. But go
exactly.
ahead.
So it's like just having a space to where it's like, oh, I should address this thing here, and it's like life transitions. Maybe moving from one place to another, you're feeling alone, you feel isolated. A lot of people had that during the pandemic. They didn't really have close people that they could talk to. Or they just felt isolated, and you saw people start to cope in different ways. Maybe it's alcoholism, or maybe it's the mushrooms and the weed, it's the video games, it's the comfort food. Sorry, that's me.
Yeah.
So everyone has like all these things that we do that we call self-soothing.
Right.
But I think being consciously aware of like, okay, this is a space designated just for me to heal, for me to learn. I think that's also really important.
Yeah, so I get what you're saying. The pandemic definitely brought out a lot of thirstiness in people. We saw it in two ways. We saw it in two ways. Okay, we saw it in terms of alcoholism and obviously OnlyFans. OnlyFans.
I was on the apps for like a good half hour, and I was like, you know what? Let me delete this.
Yeah. Wow. Okay.
I thought it was depressing. I saw a couple characters. Like, I think I'm good.
I think my coping skills are a little. I think maybe taking to the bottle is a lot better than taking. Or
just be on the app. You're like, you know what? I'm not that bad actually. And then
exactly. You're like, let's just trash this. You're like, I'm not that desperate. We're gonna come out of this. We're gonna be fine. Yeah, exactly. Speaking of coping mechanisms, what are some of the things you've used? For you. Self-soothing. Obviously, we all have our own things. I'll go over it, but I want you to go over yours first.
For me, I would say, like, anytime I get really overwhelmed in general, I would say I have like the basics, which is like the simple things that we can do like right now, as we're waiting to get to therapy or whatever that is, we're waiting for that, whatever. It's trying to get enough sleep, 8 hours of sleep, eat a balanced diet, move my body. Yeah. Because I think once like you're laying in bed because you don't feel good, you don't want to get out of bed, right? And like when people talk about like being depressed and you don't want to get out of bed, then for me to get out of bed, it feels counterintuitive. Like, why would I want to get out of bed if I don't want to? But you actually get out of bed so that you feel better. Yeah. You don't wait to feel better to get out of bed. So even though I don't feel like I want to do anything, I still try to keep a routine, go and take a walk, move my body at some point is really beneficial to me because then I just feel better.
Yeah. No, I know that feeling. this was before the pandemic, before everybody was like, oh, I'm not leaving my house in my pajamas kind of deal. I went through like, I've went through like depression on a scale where I didn't leave my house, and nobody had to tell me you shouldn't leave, it was just me not leaving my house. I weighed like 260 pounds, that was my heaviest. And I didn't leave my house. I was always in bed. And I remember my mom, coming in and saying, you got to go and find a job. You're lazy, and this and this and that. And I was like, nah, I'm not lazy. And she's like, I'm not lazy because I stay in my bed for so many hours, longer than most people. I said, technically, I'm an overachiever, okay? I'm overachieving and sleeping. But the thing that you're saying about, getting out of bed and moving, sometimes when you're in a depression, you're just like, man, it's not even worth it. Fuck it. Like, I don't care, and for you to kind of, differentiate at that point, I think that being stuck in my bed made me even more cynical.
Oh, yeah.
Because you're like, oh, fuck. Like, is it even worth it, And you're just sitting there waiting for yourself to die. I went through that forever. I went through that for like 7 years. I was in my bed and I was just waiting to die. And then it did happen. I got a blood clot in my leg.
Oh,
and then I got one in my lung, and and it was for the dumbest thing too. I slipped and fell in my bathtub because I was drinking pickle juice. I'm sorry. It's just that's depression will make you drink pickle. Well, depression will make you. That was my coping mechanism. Was the pickle juice, because that made me feel good. I was like, this is great. I love the flavor. I just don't ask. I mean, you could ask later on, put it in the comments, I guess, and say, hey, I drink pickle juice too, and we can trauma bond. But yeah, I've been in some weird places mentally where, all I wanted to do was lay down and drink pickle juice. Apparently that causes blood clots. But yeah, so, I guess we got off subject with the...
Oh, yeah, you were asking me what else I do. And I think journaling, I think, is big for me.
Right.
I think sometimes, even like with my comedy, people are like, oh, you have such dark material. I'm like, do I? And I'm just like... Because sometimes I write, like if I get really annoyed with something, I keep writing about it until I'm like, okay, I'm done. Like I got it out, and then I rewrite it into a comedy, and then I rewrite it for like the audience.
Right.
But the first draft is always I just write for myself, and then I feel like I'm preoccupied, and then I think of it, and then I feel like humor, like we said,
humor will get you through it.
Coping mechanism. So that it's always like where I filter out through, you know what I mean?
Yeah.
Like if something dark really happens, something sad happens, then it's always gonna filter out into comedy because I like to write comedies. You know what I mean?
Yeah.
I like to have like a
dark
happy
comedies, ending. Dark comedies like Dante am I saying the name right? It's a literary reference, but I'll look it up. But yeah, you write dark comedies. I get what you're saying. I guess like all of our material comes from just writing for therapy, because that I feel like I mean that's how it started for me too, and
it helps though. Like you find like I feel like there's like I feel like I'm digging for an answer, and then eventually I'm like, there it is. This is the thing I was trying to say.
Yeah. Well, it helps, but it also pisses off your therapist. You know what I mean? Because I remember. I feel like I first started doing stand up in therapy, and my doctor was like, that's not a very healthy way of looking at it, But they would make you write, apparently now when you write like a list of goals, people will call them manifesting or manifestations, and I'm like, I don't know, if you write that down and then you go shoot up a strip mall, then it turns into something else, like that was your that's what the doctor was telling you to do. They were telling you to write a list of goals. Apparently that turned into a manifesto, and here we are. This is the dark humor that we're getting at. But yeah, I've been in situations where I feel like me, being open about, some of the things that I've written in my journal that I thought was humorous. The doctor was like, I don't yeah, I think you need to keep coming back. You know? and yeah, of course I still went back. I wasn't gonna stop. But I did stop recently. Not by my own volition, but just because the therapist that I had for like 12 years that kind of helped me through a lot of some of the rough stuff. He found another job. And no, it was fine because I was very happy for him, but I kind of also asked him if he found a job because I was bad.
Was that your like last session? Or?
Yeah. Well, I mean, he was still my therapist through the pandemic. So, but we didn't, it was most like it was telephone kind of deal. But yeah, he helped me out a lot. But apparently I wasn't his worst. And yeah, he was very open about that with me, and he's like, you know what? Out of all my patients, you weren't the worst. And I was like, that's a badge of honor. I think like, I wasn't the worst, but I knew I was.
The
best.
No,
not the best. I mean,
you're somewhere.
I was the best at being what I was. Yeah, I was the best at being schizophrenic, but not the worst. I wasn't. So I'm like, yeah, I got to be good at something. I'm out here taking all these jobs nobody wants. So. But yeah, so I journal too. I journal a lot more, but like different things. I feel like if people saw me journaling now, they'd be like, this is very hateful. Because I do a lot of roast. I do a lot of roasting. So they'd be like, who are you insulting? I always come up with I come up with fake profiles of stuff.
So I guess roasts are also a coping mechanism.
Yeah, roasting.
They're a safe space.
Roasting is another coping mechanism. Yeah, comedy is a big coping mechanism, apparently. It's a healthy one because at least like you could say you want to strangle somebody, but people know you're not going to do it because obviously you've told everyone. They're like, why would I do it now when I told everybody? Then it's not a surprise, So yeah, but I've had some people kind of like I've had people get upset with me, about talking about my. I had a white woman one time. She was in the audience. She's like, you're very brave, but it's not considered a mental illness. She's all like, it's neurodivergent. And I was like, bitch, the fuck? I said, the cop isn't going to know that. The cop isn't going to give a shit, dude. If I'm running down the street, they're going to be like that. There goes a neurodivergent person, They're going to be like, no. Then they're going to bring Chika in right here. They're going to be like, hey, you know her. Can you get her to put her clothes back on kind of deal? So, I mean, yeah, I love talking with you about, mental health and
do you get some I guess you do get, but you do really well though. So I bet you do get a lot of positive, like people give you positive feedback about your material too.
I do get, I get like a mixture of, it's strange. I get a mixture of like people who are like, they will agree with what I'm saying, but then they'll like shoot at me like it's still not gonna hurt. I'm like, the fuck? Like, yeah, I was just vulnerable with you on stage, and then they come and they insult me afterwards like I'm gonna like that shit. I'm like, motherfucker, that still hurts.
I know, I was like, when I'm on stage it's fine. Like when I get off stage I'm actually a real person too.
Yeah,
so, like...
yeah. That's the same thing. It's like once you clock off, like you have a on and off switch. You're like, once you clock off, you're done. You're still a person, You're like, you're trying to fuck with my misery? Like, nobody can talk shit about it but me, No
one's ever said anything to me, but I've heard through the grapevine some people don't like.
Oh.
I'm like, okay, that's fine. But I know why I say what I'm saying.
What grapevines are those?
I would say just never, it's mostly male.
Oh.
Mostly other, so it's like, like when men critique you, you're just like, you have to filter it through like misogyny and like all that kind of stuff. So then you
just insecurity in general, just like that's a big insecurity filter, it's
because I think what would happen is like they would critique it, but then they try to rewrite it. I'm like, well, I would never say that because first of all, like I don't sound like that because you're writing from like a male perspective, so of course it's gonna sound different.
Yeah.
So it's like that's why you can't really take critique from like I don't say from anyone, but like, you have to filter like the source. Like
I had someone that came up to me and they're like, oh, you should write your story like this. I said, motherfucker, did you? I said, they're trying to tell me how to tell my story about growing up. And I'm like, were you there? Did you see that shit happen? What kind of DeLorean are you in, motherfucker? Come on, tell me how much of an expert you think you are on, my life.
Yeah.
And that's disappointing. I don't go and tell them, hey, well, I don't see you, jerking off on, because obviously a lot of these guys that try to give off that kind of critique, they usually tell, jerk off, or like they should be wearing the explicit clothing, I think, because they're so used to showing their dick on stage or talking about it.
And
I'm like,
stage.
yeah,
and in cars apparently too is what I've heard.
Oh God, no. But anyway, let's get. I love this. Let's get back on the yeah. It is part of mental health. I mean, we did kind of get into how it's like being just being a female comedian too, and a woman of color. Obviously, I don't know why they think we're not knowledgeable of anything. Like, I'm so dumb. I don't know. I'm not aware of my life. Oh, can you please help me? Exactly. I don't know how to write a joke. I just, I went through all these arduous, classes just to be a nurse or to be a doctor, and I'm still so very clueless. Help me. Doing that hurt. Doing that little impression.
the reenactment was
yes,
a lot for you,
doing that impression of a helpless person hurt, I think, because even though, yes, I do have a mental illness, I know I'm not helpless. Yeah. And I think that that's kind of something where a lot of people mistaken people that are very in tune with their feelings. They mistaken it for weakness. Mm-hmm. And that's not what that means,
And I agree with that. And I think sometimes, because I was having a conversation with, it was an African-American male.
Oh, God. Okay.
And we were talking, and he was talking about like, like how mental health it's not for Black people anyway. Like we just I guess like Black community is very much like Christian, Baptist, like church oriented. Like that's kind of where you go.
Yeah. Like
therapy is not really like our thing that we do. And I was encouraging him to go. Right. And he was like, oh, but like if I go to therapy, then people are gonna look at me differently because men are supposed to be strong and this and that. And I'm like, well, if you subscribe to that, but no one you can go to therapy and no one has to know.
Right.
Right.
Yeah.
And the thing about it is, like you said, you're not helpless.
Yeah.
And I think like the answer, if I felt like the answer, let's say to my depression or to my anxiety was out in the world somewhere, you're going to be constantly chasing something. Right. But at some point in therapy, they kind of let you know that you have to empower yourself. And that's where you find control over your situation. Like, okay, I can make these choices. Therefore, I do have some control. I'm not a helpless person.
Yeah.
I think that's one of the things that we've seen is like patients when they feel really helpless, like we said, that's really dangerous, especially like when it comes to depression. So like when they have just a slight like degree of, oh, I can do this for myself, that means something. It actually means a lot.
Yeah,
that means you're not helpless. That means
you
can actually make different choices. So I think that's really important.
Exactly. Too. It does mean a lot. Having a sense of autonomy means a lot for people. And, that's kind of, I mean, I'll touch on the thing about going back to minorities and then males. But that sense of autonomy, I feel like that, kind of helped me more when I realized, oh, I'm an adult, I'm in control, because when you're getting help, specifically for the diagnosis that I have, a lot of people will try to make decisions for you because they think you're not capable of doing it for yourself. And I think that is a toxic way of dealing with patients, and, kind of getting into like, I've been hospitalized multiple times. And what always gets me is when they make you sign all these paperwork, you're signing your rights and all that, you're basically signing your autonomy away to somebody else so they can care for you. The one that always struck a chord with me, and I know like this is a sensitive topic that I've actually kind of touched on, is the whole gun control thing, where, you're like, well, if I've been admitted into a hospital on a 5150, I cannot own a gun, I cannot be around guns, that type of thing. And yes, I do agree that is true. You shouldn't be around them. But at the same time, that seems manipulative because you're not... Those people that are signing that paperwork, they're not necessarily of sound mind and body. Like, why are they there to make that decision? Don't make them sign it until, like, let's say they get out of the hospital. They're like, well, we know you've been in the hospital and we need you to sign this paperwork, until they've reached a point where they can make that decision, by law. please sign this now that you are of sound mind and body, because I've been admitted, I've just signed shit just because, you know, I didn't know what it said.
And that's one of those things too sometimes, especially like especially when it's like when they're forced to be there versus like when they have a choice. And then they have to, you know what I mean? So it's like, well, in order for us to help you, we need you to sign this, otherwise we can't do anything, because then we're gonna, you know what I mean? It becomes like that whole like liability type of situation.
You could,
so I get what you're. Exactly
you
what
could
saying.
basically be giving the power of attorney to just some fucking rando there in the hospital. You know what I mean? And they're like, hey, well, when she leaves, I fucking own her. You know, her ass is mine. I've always thought about that too, and I just think that that's kind of that's another fucked up thing. I know, like, it's just not necessarily like. Everybody's always so quick to say, yeah, the mentally ill are the reason why this and this and that happened. But I don't think anybody's like really going into, you know, trying to take care of it, you know, at least in a political way, or even just in a practical way. Not, you know, not even politics aside, you know, like where I know that the mentally ill are always the people to take the brunt force for, you know, everything that goes wrong. It's kind of like we're the ISIS of the country, you know what I mean? Like, we got to claim it. We got to claim it, you know, like, yeah, I did it. So now I'm always just admitting a fault in everything that I do, you know, like if something goes wrong, like, yeah, the mentally ill did it. I did it. I know it. Sometime in my life I must have done it. But, you know, there's always that thing that, you know, you go, they always want to put it on somebody else, you know. It's kind of like a way of relinquishing accountability, I think. And for going back to the whole idea of like men not wanting to get help, that's also another way for them to kind of relinquish accountability, you know what I mean?
I agree. And I think that's the point I was trying to get to him, because he was just like, oh, well, if I go to therapy, they're going to look at me different. I'm not going to be seen as strong. I'm like, well, you're holding on to a standard to your own detriment.
Right.
You're saying you're not going to get help because of this. And I tried to explain to him, I said, listen, like capitalism, let's say white supremacy, let's say the patriarchy, right? I know men hate that word. The patriarchy, they don't care about your mental health.
No.
But you have to care about your mental health. You know what I mean? Like, if not, like none of these stuff is going to change. Like I told him, I said, I understand what you're saying, yet racism is real. You know, I know people might try to gaslight you and make it seem I'm validating what he's saying, but at the same time, I was like, yeah, racism also doesn't care about your mental health.
Yeah,
you know what I mean? So you're not helping yourself anyway. And I think that's what sometimes where people always talk about, pick yourselves up by your bootstraps. I get the sentiment, you know, like when it comes to like mental health, right? We have to take care of ourselves because we're not helpless. You know, we're not helpless within the system, but the system does exist. Right. I think that's what I was trying to get him to understand. It's like, yes, I'm validating that these systems are in place, but they also don't care about your mental health. So you have to do the work. Unfortunately, you know, having like a mental illness is burdensome on the individual person. You know, I think also it impacts like the relationships we have with other people, because then they feel like, oh, they're looking at me a certain way. And even though it's a burden, it's still that extra work that we have to do for ourselves, you know?
Yeah. That's a lot of the things that I, you know, encounter. I think that's where a lot of the anxiety comes from, and just finding, you know, the right person that you can talk to, that you can open up with, you know, and that comes with the challenge of, you know, taking your mental health into your own hands, you know, because you're like, now I got to go through an interview process, and now I got to be with these fucking doctors, and now I got to be vulnerable, and
that is hard. But the thing about it is, like, it's so much harder to be vulnerable with an unsafe person.
Yeah, because they don't care. Because there's nothing. Yeah, there's nothing in it for them.
Like
They're
I said, you might have a partner. Maybe you have the best partner in the world, but your partner's not a therapist.
Yeah.
Or you can have the worst partner ever. So now you're confiding in a person that's going to use it against you in 6 months.
Yeah. No. Well, because they have nothing writing on it. They're like, oh well, whatever. You know, it's like if you want a therapist, talk to the fucking homeless guy in the corner. You know, and then as long as you give him dude, I swear to God, if you open up emotionally, he will not ask you for money. You know, he's just gonna be like, fuck this, I'm not here to listen to that shit. You got more problems than I do, bro. You know, I could just imagine somebody like, hey, would you talk to me? They take off, you know, they're like, I'll do it for $1. I'm like, ooh, really? That's a challenge right there. But yeah, so I feel like getting through, you know, a lot of the things, just it takes a certain level of self-awareness, and that's where the mental work comes from, is realizing, oh yeah, hey, I have these behaviors. I mean, diagnosis aside, you don't have to be like me, you know, diagnosis aside, it's realizing that you have these behaviors that you kind of want to address because you realize that they're not beneficial for you anymore. They're no longer helping you, you know, move forward, even just as a person, or like there's no growth going on. And I think that that's where a lot of the depression comes from, is it's just you being stagnant. And a lot of people aren't willing to say, oh yeah, I'm depressed because I feel stagnant, you know, because then that would require you to just reassess your whole life.
Yeah.
And some people just get complacent with where they are. And yes, while that's a good thing to be comfortable where you are, but it's also, if it's going to make you depressed, assess your behavior, assess your life. What's the worst thing about changing?
And that's one of the things that we assess for. Like, we often assess for insight. Like, does this person have a self-awareness that their behaviors are problematic, right? Because we can talk to people about having like an addiction or depression or anxiety. So I have the awareness that I have these things, but then, okay, when you adjust your behavior, then it becomes 10 times harder. Yeah. But it's not really helpful to be like, oh, I know I do these things, and then you just keep doing it. Yeah. So I think that's the work piece. But like, yeah, we assess for insight all the time. Yeah. That's one of the most important pieces. I
mean,
think, for
speaking
success.
of addiction and things like that, I've seen a movie where, you know, someone was like, well, what if I just do heroin on the weekends? You know what I mean? I'm like, God damn. I'm like, maybe if you could still function the rest of the week, and then you can like microdose some heroin.
You find the right.
Yeah, you got to find the right amount of cc's. You're like, this is enough for me to get, you know. And I remember doing things like that too, because I've also had my dangerous amounts of coping although they're not I never did heroin. Let's take that. I did drink a lot, mostly because when I would drink, like, it would slow things down in my head. So yeah, and I was still able to function in a way. I don't know how, but at the same time, it's still, again, against my own detriment. I didn't realize it, but I remember when you're in the hospital and I'm doing my manifesto in the hospital, like they told me, you know, and I remember my doctor was like, well, what are you going to do about this alcoholism? And I said, well, I'm only going to drink when I get out of school. I promise. And I remember putting it in the list saying, okay, you just drink alcohol with Red Bull. So you're still drunk, but you could be energized. And I remember thinking in my head, yeah, this is a good plan, you know? I was like, I'm going to make it.
Like, you know how it's like you have to meet your patients or meet people where they're at?
Yeah.
And we have patients that come in, they're like, oh yeah, I smoked this much weed. And then it's like, you come up with a plan, right? You know, you have to do the motivational interviewing that we call it. You guys can look it up if you want to. And it's like, you try to meet them where they at. So it's like, healthcare workers and like therapists, like, we don't make you do things. We're trying to come like alongside you as like a support. Yeah. And sometimes like people are like, oh, they're trying to make me, where it's like, okay, no, I'm trying to support you in your decision. Yeah. And it's like, you may not do 100%, but okay, 20% is good for now. Yeah. You know, then we set goals over time.
Yeah. So I guess that's why that question is, well, how do you feel about this comes up? You know what I mean? And I remember my therapist doing that shit to me, and she was like, well, how do you feel about drinking Red Bull while you're at school? And I say, hey, I'm not driving, you know? And that was my reasoning behind it. It wasn't the best, you know, and now I realize it. Because now and this is what I mean, where I work hard. Like, I work out hours on. Today I missed it. I missed a day just because it was busy. And but I work out. Shout out to my personal trainer. Thank you for helping me. Shout out. Yeah, I work out a lot. Mostly because I want to shed the skin of my depression. And you don't realize it. You know, you get in your head when you're working out too. Like that's That I mean, I know, you know, because you come from an athletic background too, you know. So, I mean, it's just
a lot of mental, because it's like your mind. They said like your body will quit before your mind does, you know. Yeah. So it's like you have to like just push yourself. Yeah. And then when you see that you can do it, it's like, oh, I can do the hard stuff. I wanted to quit 5 minutes ago, but I'm still here. So it kind of like reinforces, you know.
Do you ever get anxiety attacks while you're running? Because sometimes
who says I run? That was a lot. That was a big assumption.
No, I mean, okay, because I always think that when people they're doing all the machines, and I'm like, okay, because I remember in high school.
I'm like a power walker.
I know, okay. When I was in high school, I had a friend that was in track, And I remember she used to tell me the thing that would make her run faster was she would imagine dogs chasing after her. And I was like, that's just because we live in the ghetto, bro. Like that. Like that has nothing to do. But I guess it worked. You know what I mean? And I imagine that. Like I never ran track, but I remember being on the level because I remember she told me, why don't you run track? Because I used to be able to run a mile in 6 minutes when I was younger.
Yeah.
But I was also, very thin and frail and I want to get back to that. The quickest that I can run a mile now is like maybe 9 minutes.
That's pretty good.
Yeah, you think so?
I was like a walk one, run one. Even though I ran track.
Yeah.
I'm saving my energy.
Yeah, no. I love running. It gets me like a quick dopamine hit, But I also yesterday, speaking of it, yesterday I had an anxiety attack while I was at the gym. I don't know why. It's just stuff that'll go through my mind. I'm like, why am I thinking this?
Are you just there?
Yeah. And I'm like, I want to scream on the machine, but then I realize you got to remember where you are. You're around all these people. They're going to freak out.
There's a few that will scream and then we just turn around. He's just like has headphones in.
Oh, okay. Yeah.
Do we have a nurse?
Yeah. No. I don't. Yeah. I've never. So I've usually like when I work out, this is what anxiety looks like when you're working out. You go into that room, if you're in an LA Fitness, you go into that multi-purpose room,
the quiet corner. And
well, after I started doing that, I noticed everyone else at the gym was paying attention to me, so they started taking my
I noticed like women started to do that, like because like for me, like I don't want like to work out like in front of like a bunch of guys. So then I would come in there, so it was like all women, like in our little safe.
Yeah, you're in your little safe corner, and then you're in front of the mirror. Yeah, and you're with because I have my sanitation wipes.
Oh yeah,
and not the ones that they give you at the gym, because I don't feel like the bazilchium chloride
doesn't do anything.
No, it doesn't do shit. No, it just makes your hands
allegedly
really dry. it just makes your hands super dry. Allegedly it does not do shit. I take the alcohol hand sanitizer. That's one of the things that they never told you was that. Going to the gym, you're also gonna, chug down hand sanitizer because I feel like I burned through so many bottles of it. Yeah, but self-awareness, working out, coping mechanism. We ran through it all, Chika. We ran through it all. I mean, I love hearing a lot of your journeys as a comedian and everything that comes in between, and I know that we've all gone through things where we need that support system, and I'm glad that you're my support system outside of this, and I'm always happy to be there for you, always.
Likewise, you really saved me, because when I talk about like not having a safe person, I was like, wow, you're the only person who I didn't feel like I didn't have that instant regret.
Yeah.
Most of the time I would have that. I'm like, oh, I didn't share it with the right person. But for you, I always feel good talking to you. I always feel good after the fact. And I think don't underestimate having a safe person to talk to. Yeah. It's really important.
Well, what's also important with safety is confidentiality.
That's a big one.
Confidentiality.
Not only that you share, but that you're also going to share with everybody else.
Yes,
that's another thing
exactly.
Too, for sure.
Confidentiality is a huge thing. And I think that's kind of, where I'm coming from is I understand that, certain amount of like, okay, well, if people come to me, then I'm not going to say anything. Well, first of all, who the hell am I going to tell my voices? Am I going to say, yeah, exactly. Am I yeah, that's all. We're all sitting here, we're all going to listen through this. But I appreciate you for, everything that we've gone through as female comedians, and then just, growing from that, and kind of being each other's support system out in the fields. Out in the fields. All right, so this wraps up our first episode of It's Gonna Be Okay. My name is Carissa Gomez, and thank you, Chika, for being on here. Where can we find you? What's your Instagram handle?
Oh gosh, I'm at Cheek, CHEEK_911. 911 for emergency, not 911, in case anyone asks. Just to clarify. Just look out for me, guys. Thank you.
Yeah, thank you so much. And we wouldn't be here without you guys. So please give us a follow. There will be more episodes of this, but different comedians. hopefully Chika will be back to share more segments.
Oh,
I'm
yeah, I
sorry,
have plenty of stories.
more segments of the horror stories in the
So
ER.
many stories.
I always love hearing those things. All right, so that wraps up this. We also have exclusive. We have Squishmallows. These are the guys here. Yeah, these are my emotional. Speaking of coping mechanisms, these are my emotional support.
I'm doing my grounding technique right now.
Yeah, exactly. Dude, these are so great. I love them. All right, they're hopefully maybe we'll get a sponsorship sometime in the future. And then I can give one to like every person that does an interview. Otherwise, I will. I'll give you one. You can choose from one of these guys. You can choose one of my special stash. You can get this one, maybe. I don't know. Whichever one you like. All right. Thank you very much for listening. My name is Carissa Gomez. I hope you guys have a wonderful evening and keep tuning in. We'll keep having more.
It's going to be okay.
It's going to be okay. Remember, it's going to be okay.